An emergency alone is enough to deal with, and we know that medical bills and the follow-up afterwards can be just as confusing and challenging. So our goal is to help you sort through some of these shades of gray and set you up with the questions you can ask to manage the cost of care.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefit systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
For this episode, we are joined by two experts, one in nursing and one in customer service, because they both have unique perspectives on today's topic. Stephanie holds a master's degree in public administration and has more than a decade of experience working in clinical settings and within the insurance industry. Ashley is a supervisor of operations with more than 6 years of experience in the healthcare industry and is well-versed in various health insurance products, including Medicare, commercial and state insurance, and self-funded insurance. Thank you for having me.
Yes, thank you. So excited to be here.
We are so glad you are both with us today. And today's topic is about understanding emergency services and the associated costs, an important but often confusing aspect of healthcare in the United States. Emergency room and transportation costs are important to understand if you're going to attempt to avoid financial surprises and ensure proper care.
Steph, I think we want to start with you first. Give us an overview. Let's define ER services and, more importantly, when to use them. So, for instance, if I step on a Lego and
That'll
I slice
never happen.
Hypothetically, I step on a Lego, slice my foot open. Should I go to the ER or will an urgent care facility suffice?
So in general, emergency services are categorized by some sort of medical condition where the patient is experiencing severe enough symptoms that they require immediate medical attention. In the absence of medical attention, the patient could experience serious jeopardy to their overall health, serious impairment to a bodily function, or serious dysfunction of a body organ or part. In layman's terms, emergency services are you need medical attention now. So now to dissect that further, should you go to the ER or should you go to an urgent care? The main distinction between symptoms or diagnoses that should be treated in ER versus an urgent care or your primary care doctor is depending on whether or not it's life-threatening. These diagnoses are some that could be certainly treated in urgent care. They're generally non-threatening and would require a prompt response, but not necessarily ASAP, right this moment, life or death threatening. So a minor fracture or sprain, mild to moderate asthma, minor cuts and burns, any common illnesses like the cold or flu or an ear infection, a minor allergic reaction, UTI, urinary tract infections. Primary care can differ depending on your own provider. So if you're not able to get into your PCP, then absolutely leverage that urgent care capability and you'll be able to see who's par, who's in network, how long the waiting times are. You can always call ahead and see how long the waiting is. Sometimes they can be an hour, sometimes they can get you in right away. It doesn't always hurt to call and shop around urgent cares either, but patients should definitely go to an ER for any severe or life-threatening conditions that require immediate intensive medical care, chest pain or any heart attack symptoms, any severe difficulty breathing, any major trauma or serious injuries, anything that's uncontrolled bleeding or any stroke symptoms such as sudden numbness, confusion, or a severe headache, or a severe allergic reaction where the person is entering anaphylaxis. A minor allergic reaction, you're okay to go in an urgent care, but if your throat's starting to close up, you better go to an ER stat. And Jolene, for your foot that has been cut on that Lego, if you're able to control the bleeding and it's not gushing out of your foot, then I think that an urgent care should be able to stitch you up just fine. No need to go to an ER for that.
I mean, perhaps that was a bit of a dramatic example, but
You're definitely
those hurt.
stepping on
It's
a
not
Lego.
dramatic. Yeah, those hurt.
So I have a question as long as we're talking about this. Toddlers, as we know, have very little bodily control. Because I make good parenting choices, my 2-year-old at one point had like a plastic golf club in his hands, in his car seat, in the back seat. Because we had guests in the car, I was in the back seat with him, and he hit me with said golf club. All of a sudden, I could not see. So he hit something in my eye, and I was like, well, I have to go to an emergency room for this because I don't know where they have eye specialists. And I don't know if that was the right place to go, or if you go to the wrong place, would it ever be denied? Like I should not have gone there.
I can kind of jump in here. From what we see on our end is that is a good example because there are times that an injury maybe is more severe and you do go to urgent care first. And those urgent care doctors and nurses will tend to let you know, we are able to do this amount of work here, but you will need to seek ER care for the following things that are occurring as we're not able to handle that here. And from the customer service side of things, that does mean that you're still paying your urgent care copayment. They did provide services. Those services were rendered, but now you are going to have an ER copayment on top of that. The same thing can happen when you might be going in because you happen to need imaging. Maybe you feel you've fractured or broke something. A lot of the urgent cares will tell you up front they don't have certain types of imaging. I do believe some are building those in now, which is helpful. But in those cases too, if they see you and treat the open wound, but then tell you they don't have imaging, you will have to pay that copayment and go to the ER for your imaging.
If you start at urgent care and they can't see you all the way through, while you'll have that copay, you would know that you tried to save yourself some money before you go end up in the ER, versus starting with the ER, I guess, and automatically assuming all of those higher costs. So what could be frustrating to pay both? You could possibly be seen and take care of some of those things at a lower level of cost and maybe more quickly than you would have in an ER.
Sarah, I do want to bring up just one consideration from your question in that could a member be billed differently for an ER visit if it is considered non-emergent? And that is a contingency within some plans. So I would always advise a member to look into their plan and see, because knowing that ER visits are higher cost and knowing that there are other options like even telemedicine or an urgent care or leveraging the PCP, there are some plans that do have a higher member responsibility for a non-emergent ER visit. So something that you could have and should have gone to a lower level of care. There are plans that could leverage and increase member responsibility, not in a punitive way necessarily, but to steer members through the best channels. Because if everyone went to an ER when they sprained their finger, they would never get to people having heart attacks. So it's trying to kind of delineate out those severe conditions and ensure that those that are going to the ER truly do need to be there. Just to be cognizant of that, it's not for all plans. It is very subjective on the plan design and how it's been structured out, but that is something that we do see in some plans, in that members can see a higher responsibility if they do go to an ER for something that may be categorized as non-emergent.
Oh, good to know. Well, plus just in general, like the cost of Band-Aids at a hospital versus the cost of Band-Aids anywhere else is unreasonable. So, all the way around, I get that. Panic usually sets in long before I have decided where to go. So sometimes my choice is not the choice based on the plan. It's based on my inability to handle medical conditions.
So it's kind of floating around in the back of your head. But clearly, if you're in the middle of a medical emergency, get to the hospital. I mean, that's kind of rule of thumb, right? Although, if you've got some of these scenarios in your head, it can kind of help you navigate and make better choices. But again, when you're in the heat of the moment, I think most people are going to just get to where they need to go based on the injury or the circumstance, right?
And then they end up talking to Ashley and her team. In the moment, you make what you think is either the right decision or the decision that you need to make at that time because of where you are in your own head. And then once you're done and you get the EOB, then you kind of have to comb through what are all these charges and bills and things like that, and how do they make sense? That's where they end up with you, Ashley.
Yeah. And sometimes members will call in the moment and try to ask our team what is the best direction. And we do let them know at that time, we are not medical professionals. And you really do, like Stephanie said, you want to reach out to your primary care physician, go to that urgent care, look at the symptoms and assess appropriately. But at the end of the day, even Jolene just said, if you are needing that medical care, go get the care that you need. And then we can work through those questions, concerns after. But really, them as the member, they come first. Go get the care, you need the care. And then we can kind of go over benefit questions from that.
All right. So then let's shift gears. And let's talk a little bit about EMTALA or EMTALA. Stephanie, if you could share some insight on that.
Yes. So MTEL is the Emergency Medical Treatment and Labor Act, and it guarantees all Americans the right to seek care at any emergency department, regardless of network status. And they are able to utilize that regardless if their insurance is par with that ER, if they have insurance. Emergency rooms cannot turn away members based on their insurance coverage. So
so if you're sick and on vacation in Miami, go to that ER. And don't worry about, are they in network? Are they out of network? When you need emergency care, you go and you will get treated.
Yes. So yeah, if an ER is at capacity, that caveat is called out here as well. The EMTALA requires hospitals to transfer patients to another facility that can provide the care. Yeah, if you're out of town in Miami at the Miami versus Bills game, something happens, you go to the ER, they have to assist you. Unless they're full, then they need to provide you transport to another facility that's able to assist you.
EMTALA doesn't make it free.
EMTALA does not make it free. Yeah.
It just means you can go and get care.
Right. It certifies the patient's right to get that care. I would always recommend calling your insurance company to find out more about the plan-specific requirements for emergent care. There are times that if you are sent in through the ER and you end up getting inpatient, then that automatically becomes in-network through your insurance plan. But it is also subjective plan to plan, just another consideration to be aware of. If you're
Steph, real quick, I'm going to cut you off because I have learned from you and Laureen that overnight does not mean inpatient.
Correct. That's a big call that we get. That's one that a lot of people are misled by because they're assuming I slept there. That's considered inpatient, but that is not always the case. And my team is able to pull up how the claim was processed and go over those details and explain the difference as to why or why not it's inpatient. And we can also review the benefits and how they differ between observation and inpatient.
We talked about the difference between inpatient and not inpatient. And I did not realize, I assumed if I was overnight, right? They're keeping you.
Right.
So how are you not inpatient? So I think it's important as a part of, they have to see you because of this requirement that you can't be turned away. How it processes would change if you are determined to be an inpatient patient by the provider. And that doesn't necessarily just mean that you were there overnight or even for more than a day. It's just the difference between observation and a different kind of level of care, as you've explained it before.
Yes.
But who would know that unless you're a nurse or you work in a hospital or you're in customer service for an insurance company?
I know there's so many things that you don't know until you know, whether it's what's the difference between deductible and co-insurance, even unpacking those basic terms. And then you get into the nitty gritty of different medical benefits and the different levels of care that can occur within a hospital. You think of it in that way, you can go to a hospital and be in the ER or be in observation or be inpatient level of care. Then we get to other, like you could be in a rehabilitative level of care. You could be in the MRU. You could be in a subacute. Like there's all these different levels of care. And the more you start digging, the more you find. And it's so easy to get lost and get confused by it. So we're here to try to simplify it and make it as black and white as it can be, but it is also so subjective based on each plan and each person's plan requirements and their member liability for each of those services as well. It can differ. Your copay for an inpatient admission versus an ER visit, even if it's at the same facility, your copay can be very different depending on your plan.
That's what we were going to segue into really next is why does this all matter, right? Why is it important for people to understand these differences? So Ashley, your expertise, this is where you kind of come in, you know what people are calling about and the questions they have around emergency services and ambulances. So if you could kind of talk us through that overview and some of the types of calls you get, maybe some of the differences that you can explain to people who might be chatting with customer service representatives for their insurance plans, at their insurance plans.
Yeah, of course. Sticking with that topic of the ER visits, emergent, non-emergent, an ER visit might include several explanation of benefits. We say EOB for short. There's going to be different bills that are coming in, emergency service bills, transportation bills if you take an ambulance, your visit, your labs, maybe some imaging was done like a CT scan, and then there are doctor fees as well. There are two types of ambulance service costs that I'm going to touch on today, and those are emergency ambulance and non-emergent ambulance transportation. Emergencies are going to align with what Stephanie already went into is your, heart attack symptoms, stroke, you've had a serious accident that requires a quick transport, and sometimes urgent care by paramedics during that transport while you're on your way to the hospital. These can often be life-saving services. Your non-emergencies might include transportation between facilities, or maybe you do need a higher level of care, so you're going from one facility to another. Often there might be a prior authorization process before that transportation occurs, but that's something that your doctor is aware of or should be aware of. They always have the opportunity to call my department and say, this is what's happening, what authorizations are needed. And then my team is able to say, for this non-emergent transportation, this is what would be required. We do get calls asking if people can call transportation or an ambulance to just go to their regular primary care visit. That is not covered under the contracts for my team and the benefits that we provide under our line of business, but every insurance is different. Every policy is different. An ambulance might not be covered for a few reasons. Could be a determination that the ambulance was used for non-emergency situations, or there is a lack of a pre-authorization that was required for that non-emergency situation. If you have a bill from an ambulance service, it's likely that there may be a balance billing on there if it's not matching what your copayment is per your contract, or you've called customer service and they've said it's $50, but you're receiving a bill for $250. If they are not participating with your insurance, they can bill what they want, and you are responsible for the difference of what that charge. A lot of your policies will have your in-network and out-of-network providers. Your in-network providers are contracted. They do have to follow that contract and stick to that copayment, co-insurance, or deductible that's applied per your policy. But if they are truly out of network, they do have the right to balance bill you that difference. I'm not saying they all do, but majority of them, once they get that billed amount out there, they do want their money for those services because they're not getting as high of a payout from the insurance. And so it is their right to do that if they do.
From what I have seen in the very limited research I have done in terms of what ambulance companies are in network for a variety of networks, a lot of them just simply don't participate. Odds are they are going to be an out-of-network service most of the time because there are so very few that just participate with networks in general.
Yeah, it's really difficult. And I don't feel that it's just one insurance. I feel it's for a lot of insurances in our area that this is happening to, that your ambulance companies are not participating with the insurance. We will see that oftentimes those bills are balance billed. And we all know at the time of an emergency, you're not asking, are you participating with my insurance before I get in the back of this ambulance, right? Do always tell members, you need emergency care. Again, you go get that care, and then we'll work on the after part. A lot of your ambulance companies, if you're receiving a balance bill, will be happy to set up a payment plan with you. We always suggest asking about that so you can make maybe those financial hardships a little easier to pay it over time. There are companies that decide not to balance bill too, but you will notice sometimes that balance billed amount might already be built into your explanation of benefit because over time we've learned which companies are going to balance bill. And so we're doing the math for you already. We're saying this is your co-payment or deductible or co-insurance per your plan. But if they were to balance bill you, then this is your member responsibility.
Question, actually, if when the company does balance bill, let's say the member has a balance bill of $950, $50 copay, so total of $1,000, does that balance billed amount apply towards their coinsurance or their deductible or any other facet of their plan? Or it's just their balance billing with the provider, that's just the cost, that is what it is?
Your balance billing will not apply to your deductible. We do not track what you've paid beyond the allowed amount for that claim. So there really is no way for your insurance company to know that you've paid $1,000 if we say that you've only owed $50. What you pay between you and the provider is between you and the provider. And that's the same way around if you were to pay a provider and call us and say, I paid before I got the bill. I have a receipt and I overpaid. That's between you and the provider now. Right. You've already paid them. You have your proof of payment. We're saying you only owe this amount. but work with them now because they get their explanation of payment as well. But that's a great question, Stephanie, because there's really no way on our end to accumulate that and put it towards your policy. And it doesn't, I hate to say it, it doesn't really count because it's not the allowed amount per your explanation of benefit that you are receiving as a member. So you're always going to go off your explanation of benefit or your EOB to tell you what's truly going towards your deductible, out of pocket, all of those things.
That's a great question.
Yeah.
Putting me on the spot. I like it.
Well, I think that's a good transition into, I think what we want to talk about next is that how can we protect patients from these sorts of surprise bills? And the No Surprises Act at least did that. We're grateful for the air ambulance because those claims, I've seen in $80,000 air ambulance claims in one state to another. And so the No Surprises Act does protect against air ambulance. To the best of my knowledge, I believe the government is working on ground ambulance services as well to add to this act because I think they're seeing that can be a pain point.
Currently, the ground ambulance services are excluded from the No Surprises Act. It doesn't apply, so they can still get a bill for ground ambulance rides if the service is out of network. And this is the most common type of ambulance service provided. It does cover, though, air ambulances. If a patient is transported by air ambulance that's out of network, it requires that the patient is only billed for the in-network cost sharing amount, and the air ambulance provider has to negotiate with the insurance company for the rest of that payment.
Yep, that's correct. And a lot of the times what we will let members know is the No Surprises Act. If you are being expected to pay an out-of-network cost, and you're doing a negotiation with the provider yourself, they have to give you notice of what that amount is, and you have to agree to it. If that doesn't happen, it falls to this next step where under the No Surprises Act, they can only bill the in-network cost of sharing. So there is a difference, and I just want to point that out. If you are going to providers that you are getting services that aren't covered under your contract, or maybe you're going to an out-of-network provider, and you do agree with that provider that you are going to pay that out-of-network cost share, whatever it may be, and you sign off to that, that is your agreement with the provider. So we're not able to really call them and fight that and argue for you. But on the flip side, if you haven't signed anything like that, you are protected by the No Surprises Act, and then we're also able to do negotiations.
That's good to know. This is a lot. And you never think about it until you get the bill. Because in the moment, right, you get the care you need.
Yeah.
I feel like that's the short story. In an emergency, get emergency treatment. If you can, like me personally, if I can bring myself down a notch, I will go to the urgent care. If I can have the presence of mind and I can drive, I will drive myself to urgent care or my kid. But if you need an emergency room, if you need an ambulance, get those things.
Yeah.
Do that first.
Right.
Even when you call your PCP now, it says, if you're calling to talk to us and this is an emergency, hang up and dial 911. Same thing.
So get the care you need. Read through your benefits summary. I know it's not exciting, but the ambulance sections, urgent care sections, ER copays, coverage, emergency services in the U.S. are not free, and they are not without complication. Medical debt is one of the leading causes of personal bankruptcy in the U.S. An emergency alone is enough to deal with, and we know that medical bills and the follow-up afterwards can be just as confusing and challenging. So our goal is to help you sort through some of these shades of gray and set you up with the questions you can ask to manage the cost of care. Thank you so much, ladies, for sharing your expertise. This is a great conversation, and I feel like we could probably talk for another 3 episodes about some of this stuff, and maybe we will. Maybe we'll have some follow-up, but it's important. And I think if people are able to take a few minutes just to learn about some of this stuff up front, it will help shed some light on some of those areas. So thank you very, very much for your time. We appreciate it.
You guys are great. Thank you so much.
Thank you for having us.
Yeah, thank you so much.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.